So yes, I'm Noora Abubaker, Project ECHO team leader at SAMA office. So I'm going to take you through a presentation, which we're going to talk about what is Project ECHO. We'll give you a brief background about Project ECHO and our experience in SAMA with Project ECHO and our plan in 2023. Okay. So yeah, so Project ECHO is the concept, the whole concept is about moving knowledge and not people. So it's about connecting the subject matter expert with the learners to share a common information and helping treating the patient in remote areas. So the Project ECHO usually involves a standardized session of a 20 to 23 didactic by the subject matter expert, followed by a case presentation from the spokes or the learners, and then followed by a common discussion between the hub members and the learners and the subject matter expert. Usually we adopt a hub and spoke model where there will be a hub where the learners come and attend from, or they would attend from their mobile phones or their online access remotely. And it's, as I said, it's a knowledge sharing approach, and usually the sessions are interactive and they are of zero cost to the learners. So what they have to have is only an access to a good internet supply in order to get access to the sessions. And all our programs all the sessions are recorded and they are available to the learners in either in OekECHO, now the new web-based database, and in our YouTube channel as well. So the members of the team usually involved a facilitator, which moderate the session, and coordinator, which manage the web-based database, and also a backup personnel as well, and a case presenter from the learner. So this is a usual session in Project ECHO, which we are having here. We have an example of Cushing syndrome in UokECHO. We had the subject matter expert based in the United States of America, and here the hub of the University of Khartoum at the EDC, and we have the case presenter. And also we have a learning site in Dongola, and a spokes also from Somalia at Somali Sudanese Specialized Hospital as well. Here are our partners so far. We have made partnership with wide range of partners. Here in Sudan, we have made partnership with the Sudanese Specialized Medical Board, and also we have made a partnership with the Sudanese Orthopedic Surgeon Association, and we have learning site at Gedaref University and University of Dongola and University of Khartoum Faculty of Medicine as well. Regarding the global partnership, we have a partnership with the African Association for Oral Maxillofacial Surgeon, and also the International Association for Oral Maxillofacial Surgeon, and GASAC, the Global Anesthesia Surgery Obstetric Collaboration, and also we have a learning site at Somali Sudanese Specialized Hospital. So yeah, so this is what we have done. Sorry for that. This is what we have done so far. We had frontline echo in 2021 till 2022, and also we have trend dialysis echo. And frontline echo actually was targeting frontline doctors who are dealing with the cardiological emergencies, and dialysis echo were for the healthcare personnel who involved in the dialysis care. OMFSECHO is for the oral maxillofacial surgeon fellows. UokECHO is a general an internal medicine-based program, which touches lots of medicine emergencies in different subspecialties in medicine. And also we had SurgeryECHO, which focuses on surgical emergencies and targeting the student, medical student, and fresh graduate and house officers as well. Our distribution so far in Sudan, we have a hub at the TAM office at 17th Street, and also, as I have said, we have learning site at Dungulu and Gadarif, and also at Somalia in Mogadishu. And here's our distribution worldwide. So far, regarding our performance measure, we have reached about 3,007 learners. We have recruited about 95 subject matter experts, and we had about 72 sessions. And we had active learning sites, collection of 7 learning sites. And our learners and subject matter experts are based in about 63 countries. And so far, we have 65 cases presented. So now coming to our third objective about today's presentation, which is Project ECHO 2023 plan. So our plan for 2023 is to have a specialized program in oral maxillofacial surgery to continue the oral maxillofacial surgery ECHO in the first 2 quarters of the year. And we have CardiologyECHO also in the same period. And we have UokECHO about internal medicine, TraumaECHO about emergencies in trauma, and we have DialysisECHO as well. So regarding every program, regarding the oral maxillofacial surgery, the target audience, of course, are the oral maxillofacial surgery fellows, and we have partnership with the Sudanese Medical Specialization Board and the African Association of Oral Maxillofacial Surgeons. And thankfully, we have got the scientific endorsement from the International Association of Oral Maxillofacial Surgery. The surgical program director, Dr. Safa Mirghani, will be the director of the course. Regarding CardiologyECHO, it will focus on cardiology topic, and the target audience are the general cardiologists and cardiology fellows. And we have a total number of sessions. We are planning to run about 20 sessions, and the director of the course will be Dr. Hatem Khairallah, a cardiologist at the King at the Saudi Arabia. Sorry. And also the third program is TraumaECHO. It will be targeting the junior doctors. We have made partnership with GASOC and Sudanese Orthopedic Association. And the co-director will be Dr. Safa Mirghani as well, the surgical programs director in SAMA. Regarding UokECHO, it will be focusing on internal medicine emergencies, targeting junior doctors. We have paid partnership with the University of Khartoum and Federal Ministry of Health. And in this program, the UokECHO, we will be having the director, Dr. Bushra Ibn Auf, and we are planning also to have a co-director according to the subspecialty in the internal medicine topics. So this is the subspecialties will be the pulmonology, neurology, and endocrinology. The idea of having co-directors is to set the learning objectives of the course and to have specialized sessions in each time. Regarding DialysisECHO, it will be about dialysis care. The target audience are physicians, nurses who are caring for dialysis patients. The number of sessions will be 15 sessions, will be run over 3 months, and they will be weekly sessions. The director of the course will be Dr. Al-Walid Al-Hassan. And what is new about 2023 regarding the case presentation? We'll be having a case presenter award. So we have noted that in the previous program, there's a kind of reluctancy toward the case presentation. In 2023 plan, we will be announcing a case presenter award. which will be reviewed by the selection will be made by the facilitator, coordinator, and the director of the program. And that, I guess, it's going to motivate the learners to present their own cases in 2023. And also regarding the content requirement, the topic selection should address only common conditions that's relevant to the audience, which the SMEs has expertise in, and it's not condition that it's uncommon or cannot be managed in low resource setting, and not the condition that SME has no expertise in it. So these are two conditions regarding the topic selection. And also it should not be specific to SME describing his own procedure or his own experience regarding the topic. So our scientific endorsement so far, we have got the scientific endorsement for the OMFSECHO from the International Association for Oral Maxillofacial Surgery. And also we have got the scientific endorsement for the DialysisECHO from the International Society of Nephrology. And in the future, in 2023, we're planning to become a SuperHub, and we're planning to expand in the region of Africa to South Sudan, Eritrea, Chad, Yemen, Ethiopia, Kenya, Uganda, Nigeria, and in order to increase our reach out to the African region. There is no SuperHub in the region so far. So we're planning to become a SuperHub for echo programs. So the function of SuperHub is to supervise the initiation of hubs and to direct their programs. No, it's just to supervise and give direction of how to direct the programs and how to run the programs as well. And also we are planning to get into other health disciplines, dental echo and nursing echo, through different programs as well. And the last but not least, we are on the road to have our own model, our own online model, which will be the library for all our learning materials and learning resources. It will be available to the learners, and these will be available to the learners from their own sites. And here the team who's running the programs. We have Wissal Marghani. All of them we are intern at SAMA. Wissal, Noora, Ahmed Jamal, and we have Mohammed Siddiq, Azza, and Umar Abdullah. Thank you.